practitioner for Danesthetics Medical, and today we're doing an Instagram Live with the one and only Olivia Salmen. Olivia may not know this, but I've been following her for a while now. Actually, when I first started getting into medical aesthetics, I was following her because she did such an amazing job with her IG Reels. They were unique, they're informative, and at the same time, it really got me into being creative with my Reels. So let me just introduce her, and let's get this going. Hey YouTube, before we jump into the video, make sure you check out my Patreon account. It's designed for serious medical aesthetics providers just like you. So I've been following you for a long time. You probably don't know that, but whenever I first got into medical aesthetics, I ended up doing this maybe 4 or 5 years ago, and when I first jumped in, I started off actually on YouTube, having a YouTube channel, and then after that, I really wanted to bring in my own type of personality, but I also wanted to do it where it was fun, but not too over the top because we're still professional. And then I ran into your page and I thought, my gosh, she does such a great job with her Reels. It was super informative, very well done. It was funny, engaging, and what I really, really appreciate and love about your content is that, yes, you're very good looking, but you don't sell sexuality, which is amazing. And at the same time, I've obviously looked at you do terrific work as well. So honestly, I'm a big fan of yours, and thanks for being on this Instagram Live tonight. So I think a lot of people are going to learn quite a few things.
Well, thank you so much. That was flattering. Well, ego boost for me. But yeah, I've been following you for a while now too, and I love your content. I think same thing. You post so much educational content, and it's nice to have kind of two versions of educational content, because I feel like I do this too. Part of it is geared very much towards patients. Part of it's geared very much towards other injectors. So I think it's kind of nice to have a blend of both.
Yeah, exactly. Actually, when I first started doing the YouTube thing, it was funny because I was doing that to get other clients in to say, listen, this guy knows what he's doing. But in the end, most of my followers end up becoming other injectors. So now a lot of it is tailored to kind of both. So this is what I'm hoping to get out of this IG Live. And most of my IG Lives are kind of tailored to that. We'll be asking questions to make sure that the general public is going to get something out of it, but also injectors or people who are starting off in the field are definitely going to get some type of benefits to this too. Before we kick off, I'll do a little quick introduction. So Olivia's a registered nurse, and she's in Nashville, Tennessee from Cool Springs Plastics. And she's also one of, how does it go? So in the States, you can be certified plastic surgical nurse, and you're one of the few. Congratulations. And you're also in the point of where you're doing your nurse practitioner. How's that going?
Oh, it's rough. It's good. I had finals yesterday, so done with that class. I've got 2 more classes, so I'll be done by February.
Anyone who's done it totally understands. I feel you, and congrats on that. Keep going. So basically, what I also love about you is whenever you're posting, you're not afraid to post what you look like after your procedure. So you do like microneedling with sculpture, you do your BBL, you do your halo, and you're like beat red after. You're just walking around like you own it, and I love that.
Oh, I go and scare people at the grocery store. Everyone's looking at me and is like,
so you're doing microneedling and Sculptra. So tell me why you would do microneedling and Sculptra and why others would maybe benefit from it.
So I love microneedling in general. I've been doing that since I started in aesthetics like 9 years ago. But I like combining Sculptra with it because of the added collagen benefit. You can apply it topically. And when I apply it topically, I had a lot of people message me and ask me this. I'm just doing the reconstitution that I would do when I'm injecting in the face. So either 9-to-1, 10-to-1, something around that reconstitution. And you're not worried about that nodule formation because it's just topically underneath the skin. You're not injecting large amounts underneath the way people do worry about that somewhat with Sculptra. I think now that we don't do as often that 5 or 6 cc recon, that's happening way less. But topically, I don't worry about that. And so I like it more than I like microneedling with like PRP, for example, just because it's very predictable. PRP in your younger patients, their blood's pretty healthy. It's got a lot of that platelet-rich plasma in it, or PRF if you prefer PRF. But in older patients, you may not get a really good draw, that you don't really know how much collagen benefit you're going to get out of it. It could be great, or it could be so-so. So I kind of like PRP if we're doing it more for just the healing factor of it, but I prefer doing it with Sculptra if we're trying to get even more collagen stimulation. And I feel like it helps me heal faster as well, but that's why I use it. And you don't have to
I agree. I think that there's a little bit of a misconception out there with PRP. A lot of people think that, you know, by putting PRP on, like you're getting a lot more collagen. And, you know, PRP itself, especially in its liquid form, really doesn't do all that much. Yes, we're breaking platelets, you're getting growth hormone, but it's really the irritation of the skin that's causing the trauma. You really have to like basically piss off the skin in order to create collagen, and that's why how actives work. And this is why people who do, you know, use actives are like, I think I'm getting an irritation, or I think I'm intolerant. It's like, no, that's how it's supposed to work. You need to irritate it. So the microneedling itself is doing that, where the platelets, like if you're doing PRP, you're just kind of helping it heal a little quicker, but I don't know if you're going to get that much more collagen. Where with regards to adding Sculptra, then that is basically, you know, this is really telling your body to create collagen around that area. And if you're infusing it into the skin, if you're placing topically and you can kind of like infuse it, then it's great. And you feel you're getting good results out of it. How often are you doing your Sculptra microneedling?
You know, on myself, I try to do 3 microneedling through the summer, because even if I've had some sun exposure, you know, that's a fine treatment to do in the summer. So I like to do 3 microneedling with Sculptra through the summer, and then into the fall I might throw in a chemical peel, and then get into my lasers more into winter. So usually 3 a year, because I'm doing other things. If someone made it their primary treatment, that's what they like to do. Maybe they don't have the downtime for a laser. I mean, I'd do 6 a year if you can do it. It's fantastic. You can do them, I would say about every 4 weeks is my ideal.
Now with your lasers, and when you get to the winter, so I know you're a big fan of BBL and Halo, right? So I get you to talk a little bit about that. What's the difference between BBL and Halo and microneedling with Sculptra? I know it's a bit different, but just trying to get the audience to have a feel for it.
People hear all of these treatments are anti-aging. Why do you need different ones, or which ones are better? And really, I think some of it comes down to, it's not necessarily that you just need one over the other. Because like I said, I do all of them. It's what's your downtime, what are your restrictions, and how aggressive are you going after our targets? So Halo, out of those options, microneedling, BBL, Halo, I'll throw Moxie in there too. That's going to be the deepest to go after deeper wrinkles, more damaged skin. So I kind of just stair step it, where I'm like, 1 microneedling is going to be great. You're not going to see a night and day difference with 1 microneedling. 1 Halo, you'll see a pretty big difference. So it's just kind of what degree of treatment are we doing. If you have time for 1 treatment, let's say your daughter's getting married, let's do a Halo BBL. Give yourself the downtime. But if you don't have time to do a series of something, let's hit it hard.
So a Moxie and a Halo.
Moxie and Halo. So those are both Cyton. We just got the Moxie this past year, and I've been loving it. It's a lot easier. They're different degrees kind of their depth, how aggressive of a laser, because both of those are going to be in the laser category. So where your Moxie is a 1927 wavelength, your Halo is going to be dual. So it has 2940 and 1470. So with Moxie, it just has a non-ablative wavelength, that 1927. Halo has both. So your 2940 is going to be ablative, 1470 non-ablative. So what that means is you're getting the non-ablative collagen production, but then the ablative to further go into those deep wrinkles. So when I'm recommending Moxie to somebody, it's not for deep wrinkles. I'm going to do that for some surface level texture, definitely pigment, collagen production, maybe some pores as well. I say the downtime's very similar. They're both about a week, but they're way different in how dramatic they are. Moxie, the next day, I look okay. You know, if you look really close to my skin, it's textured. It doesn't look pretty, but I'm not swollen to the point where I can't see. Halo. And I swell more than any patient I've ever had. And I show every patient my crazy photo from my swelling. That way they're not surprised when they swell. But Halo swelling's no joke. Those first few days, you're super swollen. So it's a lot more dramatic. It can be a little scarier when you wake up the next day, like, oh my gosh, what did I do? But it's just a lot deeper. And so we can also address different things. With the Moxie, I can go after melasma a little bit easier, because even though it's a heat-based treatment, and we know that heat can trigger melasma, I'm so superficial. I'm not bulk heating the skin. I can put more tiny dots into the skin without overheating it, because I'm doing fewer joules per square centimeter. For those of you that actually do lasers, that's the difference. Where with BBL and Halo, it's a lot more heat. In my opinion, you're a lot more likely to trigger that melasma. And it may not even be immediately. It may be a couple months later, and they're like, oh, my melasma flared up. That could have been from the laser. So I like that I have Moxie now, because I can treat laser patients in the summer. I can do melasma. I can do that really difficult light brown pigment, kind of that muddy pigment. And then with Halo, I'll go after deeper sun damage, and I'll throw in BBL to address redness and brown with it as well.
What's BBL?
The BBL is a version of IPL, Intense Pulse Light. BBL is the brand, broadband light, again, under that Cyton umbrella. So I use BBL mostly to treat sun damage, rosacea, and if you're just doing a series of treatments for collagen production. I always say with rosacea, though, I'm not curing your rosacea, because rosacea isn't just a vascular problem. It's actually neuro. You've got nerve damage that's causing those vessels to dilate. I can help, but they're going to redilate later. And so it's not that you have too many blood vessels. I'm not getting rid of them. I'm just helping your dilation. So a lot of people kind of ask that, how many treatments for rosacea? Well, let's do 6, and then you're probably going to need to maintain it, because that's not something I can cure. Okay, great. Awesome. Okay, well, yeah, maybe I'll see you in September then.
See you. Bye, everyone.
Yay, bye.